My name is Lisa. I recently attended pelvic floor therapy sessions at Berks Physical Therapy with a pelvic floor specialist. I did 3 sessions, and despite some apprehension, I'm here to tell you that the pelvic floor specialists were wonderful, very compassionate, very caring, very knowledgeable. And here's some of what I learned. So the pelvic floor girdle is made up like a basket, almost a sling if you would, of 35 different muscles. And if those muscles either are stretched or are not as strong or simply can't coordinate with one another, you're going to have an issue. What might those issues be? Well, it could be that you either have some sexual dysfunction. It could be that you have problems in terms of leakage with urinating or defecating. So any of those could result if your pelvic floor muscles are not working together properly. And how might that happen? Well, often in childbirth or in pregnancy, those muscles have tremendous amount of strain. You might also have had muscles that are cut if you've had a surgery, either an appendix taken out or gallbladder, or if you've had a hip surgery, or if you've had a prostatectomy or hysterectomy. You also might experience problems just in general with aging, and typically those muscles weaken as we age. So you might have this resulting in not having a good sex life. You might have that you have leakage when you either can't get to the bathroom in time, or you have leakage when you cough or sneeze or exercise or go from sit to stand, or you are walking and you're uncontrollably passing gas. Those are all situations that are very common. We don't talk about it, but they're very common, but they're not normal. And that's your body's way of telling you that it needs some help. Your pelvic floor muscles need to be looked at. Now, many people have often said that they've done Kegels and they don't work. If you haven't done Kegels with biofeedback setup, chances are you've not done a Kegel correctly. So biofeedback are electrodes that get put on your butt cheeks, and they allow the therapist to see whether you are firing the right muscles in proper coordination so that that pelvic floor girdle can be assessed, whether it needs to be strengthened or whether it needs to become less strong, and which muscles have to work in tandem, in pairs. So I would encourage you, if you've not had a pelvic floor therapy session before, that you would go ahead and do that. Now, at Berks Physical Therapy, there are 2 different ways you can do that. I went down the insurance path route, which made me get a prescription from a provider, and that provider might be your OBGYN, your family doctor, a urologist, something like that. So you get a prescription. That does come with an internal exam. The internal exam is not as invasive as even a gynecology exam, but there is an internal exam with that. And then you get educated and you get exercises that control whatever issue it is you have. The other route to go is you can completely skip the script, and that way you don't have to go to a provider. You can come in, there is no internal exam with that, but 3 sessions for $199, and you can get educated and address the issues you're having, and hopefully have them solved in maybe once a week or once every other week time frame over these 3 sessions, and that would address also the issues that you have. It's important to get educated on the control of those muscles because they don't really get better on their own. They tend to worsen as we age, and none of us want to be wearing adult diapers or pads our whole life. That tends to hamper our daily living activities. So obviously we're all aging. We all have bowel scars from life in general. And so it's maybe hard to make that first appointment. You need to get past that. I did. Once you do it, you'll realize there's a whole world of pelvic floor therapy there. If you're taking care of your body, whether you eat right, you exercise, whatever, you ought to probably address those muscles as well. And that way you have the ability to handle the symptoms that are magnifying, maybe while they're still small problems, and learn, really, it's a lifelong thing that once you learn those exercises, you're going to apply them and you're going to be fine. I'm really glad I did the 3 sessions. It was invaluable. I learned so much. And I would really encourage you, it's time and money and effort well spent. I sincerely think you would benefit from that therapy. I know I did, and I'd want the best for you.